BT's Body and Balance is sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
As a woman ages and once a couple has decided they're not going to have any more children, the conversation about contraception can change. Our health specialist Leah Sarich now with what the options are for couples at this stage in their lives.
A very interesting stage.
Yeah.
I have so many girlfriends that are talking about this right now. So at this stage in their lives, contraception is a different conversation. So generally, there are two forms that doctors will be talking about. Number one is the long-acting reversible contraception. Number two is the non-reversible contraception or sterilization. So let's start with the LARCs, as they're called, the long-acting reversible contraception. So for many women as they age, you need to think about things like, for example, the pill. Maybe they were on the pill in the past, but now as their body is aging, maybe they're not tolerating the symptoms like they used to, right? Or they just don't want to tolerate the symptoms anymore. Or maybe they have other chronic conditions, like now maybe their blood pressure is a little bit high. Maybe they develop type 2 diabetes. These things may make those pills contraindication, so not a safe option for them. And also physiologically, our bodies are changing. So again, we may not tolerate these medications the way we did. This is why doctors are suggesting IUDs for women at this stage in their lives, and there are two options.
There is a copper IUD, which has no hormones at all, so a woman would still continue to get her normal periods with it. But when she gets her periods, sometimes they can be just a little bit heavier or crampier than what she's used to. Majority of women say it's a bit more, but they can manage. It's not something they want to stop using the IUD for. That one is very cost effective. It costs anywhere from about $60 to $80, and it's good from anywhere from 5 to 10 years, depending on the model that you have put in. The second type of IUD is the hormonal IUD, so that one has a little bit of progesterone that gets released locally inside the uterus.
And what's nice about the hormonal IUD, Dr. Mongat said, is it makes a plug, so it's hard for the sperm to reach the egg, but it also thins out the lining of the uterus. So many women, as they age, they find their periods are heavier than they have been, or after children, they're heavier than they have been. There's an 80 to 95% reduction in bleeding each month with this hormonal IUD. So that's a very attractive option for a lot of women. Also, that IUD can stay in for 5 years, so that may get women close enough to menopause, depending on what their age is. But let's remember that menopause is defined as not having a period for 1 year or the age of 55. So they might need two IUDs, something to keep in mind. The other thing to note about the hormonal IUD, people think hormones, I don't want to do hormones anymore, but that hormonal IUD only has 1,000 times less hormone in it than the pill, for example. 1,000 times less, and it's released locally, so it just stays in the uterus. It's not going through the whole body. The tricky part with the IUDs, and this is why some women don't like the idea of them, is they do take about 6 to 8 weeks, maybe even a little bit longer, for the body to get adjusted to it. And in that time, you might have some breakthrough bleeding in there. So you kind of just have to keep that in mind until your body gets used to the idea. But after that, of course, you're looking at a very minimal period, if any at all.
Okay, so that's on the women's side.
That's on the women's side.
So what about the men?
Right? Yeah.
Right?
Of course, there are two people here trying to prevent a pregnancy. So of course there are options for men. So the thing to remember that even though women at this age in their lives, their fertility is going down, it is not at zero. So if you do not want a surprise, or if you do not, definitely do not want to be pregnant, you really do need to do something. So the other option for men is the non-reversible option. So first of all, I should talk about the women. So there is the option for women, which is having their tubes tied.
Yes.
And the one thing to note about having the tubes tied, that is actually a fairly invasive procedure. You're going to be in the hospital for at least a day. They do it laparoscopically, so it's not like they're going to cut you open fully, but you know, there is a pretty serious procedure involved there. The other thing to note about getting your tubes tied, which I didn't realize until I had done this story a couple of times, was that you'd think the success rate would then be 100%. It is not. Yes.
Whoa.
So sometimes the IUD will actually give you better protection than having your tubes tied.
Wow.
Yes. So some doctors are actually saying, consider an IUD first before you have this serious procedure done.
Okay.
Right. So that's what it is for women. For men, the non-reversible option, of course, is the vasectomy.
And that's a much simpler procedure. It can usually be done in the office. It takes maybe about half an hour to 45 minutes. And so a fellow could go in, you know, on a Friday afternoon and have it done and, you know, have a couple of days recovery and be kind of, you know, back and okay to go to work on the Monday following. And the failure rates with them are very low. And there is sometimes some cost to that, and that can range anywhere from $100 to $150, just depending on which doctor they see and what procedures they use. Some of that portion might not be covered by Alberta Healthcare.
So something to keep in mind, but you also want to remember that these methods of contraception, think of them as permanent. So doctors don't want you to think of a vasectomy as something that's reversible, because it is only reversible in about 30% of cases.
Right.
And then it depends on how long ago that vasectomy was done. So think of that as a non-reversible option. But Dr. Monget says do consider that the time we're living in, with divorce rates at 50%, she says, you know, what you might want right now may not be what you want in 5 years or in 10 years. So do keep that in mind when you're thinking of those options.
These are big discussions
They
that
are.
need to be had by two people.
That's right. Lots on my blog.
More on your blog,
Yes.
breakfasttelevision.ca. Health specialist Leah Sarich, thank you for that.
You're very welcome.
And Dave Will, what's up out